Welcome, I'm Priscilla Wairimu, and today we are going to learn about malnutrition under subtopic protein deficiency, Kwashiorkor and Marasmus. Protein deficiency. It may occur when the diet contains sufficient energy but not enough protein. Lack of sufficient energy in the diet. In this situation, the body's own protein is used as a source of energy. Kwashiorkor. Protein deficiency leads to a disease called Kwashiorkor, which is a form of malnutrition caused by lack of protein in the diet. Signs and symptoms: hair changes, becoming thin, straight, sparse, and easily removed. The lower cheeks develop large swellings, giving a characteristic moon-faced appearance. Swollen abdomen due to accumulation of gases and distension of small intestine caused by abnormal growth of bacteria. A brief summary of the symptoms of Kwashiorkor: producing belly, brownish hair, dark and scaly skin, stunted growth, underweight, swollen legs, loss of appetite, anemia, mental retardation, reduced resistance. Marasmus. It is a deficiency of all macronutrients, that is, carbohydrates, fats, and protein. Someone suffering from marasmus lacks the fuel necessary to maintain normal body functions. Prolonged marasmus leads to starvation. The difference between marasmus and Kwashiorkor is that marasmus is deficiency of all macronutrients, and we have said macronutrients are carbohydrates, fats, and protein, and Kwashiorkor is a deficiency of protein predominantly. The difference between marasmus and Kwashiorkor. We have differences between Kwashiorkor and Marasmus. I'm going to list them down. Kwashiorkor, it develops in children whose diets are deficient of protein. Marasmus, it is due to deficiency of protein and calories. Kwashiorkor, it occurs in children between 6 months and 3 years of age. Marasmus, it is common in infants under 1 year of age. Kwashiorkor, subcutaneous fat is preserved. Marasmus, subcutaneous fat is not preserved. Kwashiorkor, oedema is present. Marasmus, oedema is absent. Kwashiorkor, enlarged fatty liver. Marasmus, no fatty liver. Kwashiorkor, ribs are not very prominent. Marasmus, ribs become very prominent. Kwashiorkor, lethargic, and marasmus are alert and irritable. Kwashiorkor, muscle wasting, mild or absent. Marasmus, severe muscle wasting. Kwashiorkor, poor appetite. Marasmus, voracious feeder. Kwashiorkor, the person suffering from Kwashiorkor needs adequate amounts of protein. Marasmus, the person suffering from marasmus needs adequate amount of protein, fats, and carbohydrates. Signs and symptoms of marasmus: wizened and shrunken features giving the face the appearance of an old man's face, sunken eyes, thin muscles, thin arms and legs, and low body fat, reduced resistance to infection, hair is not affected, very underweight. The following picture shows a child suffering from signs and symptoms of marasmus. There are sunken eyes, poor growth, thin face and bony face, ribs clearly visible through the skin. Thank you.